Hello friends, we all know that blood transfusions are the lifeline of children and patients with thalassemia, that is the transfusion-dependent thalassemia. In this video, we are going to look more closely at this particular lifeline. Why do children with the transfusion-dependent form of thalassemia require blood transfusions? Well, we know that the beta globin chain is affected or it is actually less in patients with beta thalassemia major or intermedia. Because of this, we have an excess of unpaired alpha chain, and this alpha chain is removed in the spleen. This results in anemia and all the symptoms of anemia like fatigue, pallor, easy tiredness, hepatosplenomegaly. Children develop an abnormal face, what we call as the hemolytic facies. In addition to that, there is stunted growth, and they also have delayed secondary sexual characters. So, if you give them blood transfusions, all these symptoms are lesser, and therefore, for survival, children with thalassemia major or the transfusion-dependent thalassemia require blood transfusions. When do we start transfusions in children with thalassemia? So in those children who have thalassemia major or the severe form of thalassemia, they present to the doctor by 1.5 or 2 years with a very low hemoglobin. So we start them on transfusions immediately. However, certain children with thalassemia intermedia present later in life because their hemoglobin is around 6, 7 plus or even 8 g%, and these children don't require blood for mere survival. So they present to us later and we start them as and when necessary. Thalassemia minor, as a rule, doesn't require blood transfusions. However, in special situations, these patients may require blood as well. So nowadays, we classify or divide thalassemia into the transfusion-dependent thalassemia or the non-transfusion-dependent thalassemia. So you may ask that for patients with non-transfusion-dependent thalassemia, when should we give blood transfusions? So they may require it once in a while or episodic if the hemoglobin falls very low due to whatever reason. Sometimes the doctor may advise regular blood transfusions. This might happen if the child is not growing well, has a hepatosplenomegaly, that means the spleen and liver are enlarged, or the child is developing a hemolytic face. That means there are changes in the facial structure of the child, or the child's quality of life is affected, and some other reasons as well, which your doctor will decide. So what do we transfuse? When we say we are giving a blood transfusion, so what is it that we are giving? PRBC is what is given regularly. It is actually a unit of blood from which the plasma is removed. We do not give whole blood any longer. What type of PRBC is preferred? So there is a particular amount of hemoglobin which is there in every unit of blood, and that is what the blood bank will check. In addition to it, we like to give leucodepleted blood, which means that the WBCs are removed from the blood. Now this can happen in the blood bank or it can be at the bedside with the use of a WBC filter. If you want to understand more about leucodepletion, we have a separate video for it. So there are certain diseases which are transmitted via the blood transfusion. HIV is one of them, hepatitis B and hepatitis C. In addition to it, we could have Creutzfeldt-Jakob disease which is transmitted, CMV and other diseases as well. So most of the blood units now are NAT tested, or that is nucleic acid testing. In this, we look out for nucleic acids of HIV, hepatitis B and hepatitis C. Because of this testing, we can pick up a very small amount of these viruses, and if there has been any exposure in the donor for as little as 4 days, we are able to pick it up. So that means the window period is now very small. In addition to this, for CMV and Creutzfeldt-Jakob disease, we do leucodepletion, which helps to make blood safe for these viruses. Friends, thank you very much for watching this video. I hope you found it useful. Please share it with your friends if you think somebody will benefit from it. A small reminder that this is only an educational initiative for patients suffering from thalassemia. No part of this video can be taken as a consultation or as an advice. Please keep in touch with your doctor and your institute and your thalassemia daycare center at all times. Thank you very much.